The federal government has announced a package worth $260 million that'll help improve after-hours medical services across the country. Some of the money will be used to fund centres called Medicare Locals, as Health Minister Tanya Pilbersek explains.
Well, the government's investing $260 million in 3 different ways of making it easier to see a GP out of hours. Medicare Locals are collections of doctors and other health professionals that will work together in their local community to address existing gaps in services, and that includes seeing a GP out of hours. So 19 Medicare Locals are establishing different ways of seeing a doctor out of hours in their local areas. Another way that we're helping patients see a GP after hours is by investing $100,000 in GP clinics, existing GP clinics, to help them operate for longer hours. We've just announced another 63 locations for these extended hour GP services, adding to the 300 previously announced. The third way that people can see a GP out of hours is by calling the GP hotline on 1800 022 222. By calling that number, people can get advice about whether they can just relax at home, maybe take a Panadol, or whether they do need to go and seek out a GP after hours service, or whether perhaps they need to go to a hospital emergency department.
So will this hotline be available to people right across the country in all states and territories?
Well, the hotline's been available in most states and territories for about the last 6 months, and just recently we've announced that Victoria will also be participating in the GP hotline. That'll mean that Victorians will be able to call the nurse on call service that they've previously had available, but also this GP after hours service if they wish.
And what's the response been like so far to the hotline?
Well, the hotline has received more than 70,000 calls already, and about a third of them have been from the parents of young children under the age of 5.
On another issue, how concerned are you that some states and territories won't be able to meet new emergency department targets under the National Healthcare Agreement, given that today Victorian doctors have warned that they probably won't meet those targets in that state?
Well, the Victorian Health Minister and indeed the Victorian Premier have agreed to these targets, and with these targets comes substantial extra funding. We're talking about $200 million over 4 years if states and territories meet the targets that they themselves have agreed.
But are they compromising patient care in order to reach these targets?
No, we've had very strong advice from experts that these are reasonable targets. We've amended the targets to make sure that they are reasonable after the initial consultation with health experts, and I believe that these targets of seeing 90% of people within 4 hours are very reasonable targets.
Tanya Pilbersek, thanks for joining us.
Thank you, Bridget.
And that after-hours GP helpline number is 1800 022 222. That's 1800 022 222.